Hi, my name's Joanna Thurston and I'm here to talk to you about the new and exciting sports therapy programme that we've got starting here at Bournemouth University in 2017. Our degree is accredited by the Society of Sports Therapists, and that way we know we hit all the competencies in order for you to then gain eligibility to apply for membership of the Society of Sports Therapists on completion of your degree. The areas that we look at are injury prevention, recognition, evaluation, management, treatment and referral, the rehabilitation process, and then education and professional practice issues as well. One of the most important things to explain to students, I think, is how sports therapy differs from physiotherapy. Physiotherapy is an incredibly versatile degree, predominantly focusing on the areas within the NHS where one needs to gain clinical practice skills. So we're talking things like paediatrics, musculoskeletal, neurology, respiratory, learning difficulties, things like that. So there's a really broad scope of practice. With sports therapy, we've taken the musculoskeletal element of that, and then we've really progressed that in terms of exercise prescription and rehabilitation. So what we can provide our clients is a really comprehensive injury management process. So I always liken it to the fact that you can run onto a pitch and scoop somebody up if they're injured in the field in terms of acute trauma management, and then work through the rehabilitation process with them so they're able to play 80 or 90 minutes of their favourite sport again once they've finished their rehabilitation. So it's not just about sports massage. We do use manual therapy skills, hands-on skills, massage techniques, but there is so much more than that. And when I go through the units, hopefully you'll see that it's a much broader programme than sports massage or personal training or something like that. We're not physiotherapists, which is absolutely fine because we don't need to be and we don't want to be. As I say, physiotherapists have a very important role, predominantly within the NHS. And then sort of broadening out into professional, private practice rather. But what we're looking at really is that using the exercise science principles to create an autonomous practitioner working in the field of sports injuries. We're also not just first aiders. You are able to work pitch side as long as you've got the right certification and insurance, and then therefore deal with the acute trauma management aspect of the profession. But again, you can then carry that patient through their early stage, mid stage and late stage rehabilitation. So what is sports therapy? As I said, it's a healthcare profession where we have the knowledge, skills and ability to use those sport and exercise principles to optimise performance. We can look at the immediate care of injuries, basic life support, recreational training, competitive environments, and we assess, treat and where appropriate refer on to specialist advice and intervention. We do provide sports remedial massage in a sport and exercise context, but again we have many more tools that we can use in terms of what's appropriate for our client, and we plan and implement appropriate rehabilitation programs. But we're looking at the whole holistic athlete. We might be planning programs for someone who's going to prepare for a competition at altitude or in a cold climate. So we're looking at all of these elements and how they impact on performance. So if you enter a career in sports therapy, you're entering what I call a portfolio profession, okay, embracing multidisciplinary working. You will constantly be updating your skills, and this is a really important aspect of it. You need to enter this profession if you are happy and have a desire for lifelong learning. In terms of being on a professional register, you'll have CPD requirements to fulfil each year or each 2 years, and that just ensures that you're constantly updating your skill set and therefore are using evidence-based practice and practice-based evidence. I always say those who dare to teach must never cease to learn. It's a quote that has stuck with me throughout my career. If you are going to prescribe an exercise to somebody, you need to have made sure that you've tried the exercise yourself. If you're going to talk about rehabilitation modalities with somebody, you need to make sure that you're constantly updating your skills to provide the most up-to-date and relevant research for them. So you don't enter this profession if you just want a degree and then to forget about learning. That's not what we do. We're constantly adding to our skill set and then gaining specialities and nuances that separate you from other sports therapists. So in terms of employment options then, you could end up working professionally with a full-time squad or a team or individual athletes. You could work part-time in what I would call a multiple training clinics, so across multiple training clinics. So you might work a couple of days a week in one clinic and then go and work with somebody else for another time, or have a couple of training nights that you do. You could own your own business, so you could set up a clinic on your own, working either on your own or with a multidisciplinary team, or working with health and fitness professionals like personal trainers and fitness instructors. Or you could continue your studies. There's lots of MSc study programs that you could go into, looking at strength conditioning, for example, or you could go on and complete your PhD after that. Certainly industry research is really important, but I always think it's best to, people listen to those who have been out there in the industry working. So go out there, get lots of experience upon graduation, and then decide which direction you want your career to go in. So the course structure then, the first year of the degree is called level 4, level 5 is the second year, level 6 is the third year. It's 3 weeks of study, but you have got the option of taking a 30-week placement between levels 5 and 6, so between your second and third year. One thing you need to be aware of in terms of that is you won't have your insurance to practice as a sports therapist at that stage, so that placement could be involved in an area aligned to sports therapy. So if you're a personal trainer, it could be that. You could be working as a sports massage therapist, for example, looking at strength conditioning, coaching, areas kind of associated with sports therapy, but you won't actually be able to do any sports therapy on that placement. But as I say, it's optional, so a lot of students so far are saying they just want to push on through and then gain their experience in their final year where you do clinical supervised practice. So with each year there's increased autonomy, so you increased responsibility, you are supervised at all times though obviously, and increased expectation of your ownership. So we want you to be actively seeking volunteering opportunities, actively seeking out clubs and placements that you want to work in, and securing those placements to help you kind of govern how your degree shapes. At university, we're not teachers, we're not just going to stand there telling you what you need to learn, we're going to help you manage your learning, facilitate your learning. So we have a set of experiences, I have a set of experiences from my career that make me suitable in order to be able to help you get those kind of that basic understanding of how the body works, how we can then use rehabilitation principles to enhance healing, that sort of thing. But ultimately, there's a lot of independent work at university, and we'd expect you to fully engage in the independent learning required. So this is what the course content looks like. So level 4, level 5, level 6. Semester 1 runs from September through to the end of January, where you'll have all your assessments at the end of January, middle to end. And then semester 2 is February through to May. So in your first year, you study early career professionalism. So we're looking at all of the elements in terms of helping you get used to the study styles at university and the academic requirements, research skills. But we're also looking at the scope of practice, the requirements of your conduct from your professional body, and the fact that you are actually an early career professional rather than just an undergraduate or a student. You're representing both the university and a governing body, or an awarding body, accrediting body at a professional level. You'll study research methodologies, and that continues throughout the programme. So you've got research methodologies 1 in level 4, research methodologies 2 in level 5, and then your research project is kind of the final representation of all that you've learned. Research methodologies is so important in terms of being a practitioner because we're constantly having to keep ourselves updated and looking at the best evidence in order to decide how we're going to develop our practice. So understanding the background to research and then knowing how to carry out research yourself and then to critically evaluate the research are skills that are absolutely fundamental if you're going to be a worthwhile practitioner. Foundations of sports therapy then, anatomy, physiology, biomechanics, sports massage, all those key elements that we need to get sorted in the first term in order for you to gain an understanding about sort of the fundamentals of how you're going to then work with people across the next few years. Semester 2, we're looking at athlete welfare, so all of those elements in terms of psychology, nutrition, athletes' responsibilities if they're going away, that sort of thing. Exercise prescription, so looking at basic exercise prescription in terms of frequency, intensity, time and type of exercise modalities, resistance training, free weight training, and lots of the current training methods. So we might do suspension training, Pilates, yoga, that sort of thing. Again, it's very difficult to prescribe something to somebody if you haven't experienced it yourself. Assessment of sports injuries 1 is where we look at all of the acute trauma management, so the pitch side work, and you have a 20-hour placement on that unit where you'll be observing pitch side injuries. And we're seeing how first aiders and pitch side staff respond to those injuries. So then we move on to level 5. So level 4, we need to pass every element of every assessment in order to progress on to level 5. Research methodologies 2, as I say, soft tissue and therapeutic modalities, so more hands-on skills, electrotherapy, ultrasound, PNF stretching, myofascial release, all these sorts of things. Assessment of sports injuries 2 is looking at clinical assessment, so active, passive, resisted ranges of motion and special testing. Applied physiology, because we need to have an understanding of how the body actually adapts to exercise in the first place. Manual therapy 1 in terms of looking at the peripheral joints, so more anatomy, an understanding of the mechanics of the joints and then how we can work with that with manual therapy. And then rehabilitation and sports therapy, so looking at specific principles that allow us to apply appropriate loads in an appropriate way in order to maximise tissue healing. So then level 6, final year, so again you need to pass all elements of level 5 to get to level 6. Manual therapy of the spine, so similar to manual therapy of peripheral joints, so more of anatomy, joint mechanics, that sort of thing. Sports therapy practice is where you have to complete 400 hours of clinical placement. That's supervised clinical practice, so you'll be working as a sports therapist under supervision, seeing clients to kind of gain an understanding of how you might work as a practitioner. Are you suitably confident? Have you got those transferable communication skills, for example? And just working through some of the sort of main aspects of the role in terms of the pitch side and the clinical work. Research project covers both semesters, so you need to provide an extended piece of work for that in terms of an experiment or an intervention that you are going to assess appropriately and then analyse. And then service improvement project and innovations in sports therapy. Service improvement project, we work across programmes, so you might be working in a multidisciplinary team with the physios and the paramedics in our faculty, looking at service improvement, so kind of joined up thinking, how to improve service. And innovations in sports therapy, you're presenting your innovation at a student conference with the physios and the occupational therapists, which we held at the end of the year. So a really diverse programme. There's lots of input from other staff in terms of the multidisciplinary aspects, so paramedics, the physiotherapists will come in and talk to you as well. We have strong links with local clubs, so they're involved heavily in the programme too. So just to go through the industry experience then, as I said, in level 4 you have 20 hours of acute injury placement observations. So we send you out to local clubs, we'll come out with you as well, and we observe, what sort of injuries happen, mechanisms, how they present, that sort of thing. Level 5, you've got 30 hours of observations within your assessment of sports injuries 2 unit, and that's looking at the clinical sports injury assessment and treatment. So that's the placement that you find yourself. We obviously have staff to support you in that process, but it means that you can really tailor make that placement either to location, if you want to do it near a home, or sport if you want to focus on something like that. So it allows you to kind of specialise in your programme of study whilst also seeing the full breadth of issues that we need you to see. And then finally, level 6 is a minimum of 200 hours, go up to 400 hours of supervised clinical experience. So the optional sandwich year is between levels 5 and 6. It's 30 full-time weeks. Again, it's up to you to source this placement, but we do have obviously a big placement team in order to help you. The idea is to gain a greater understanding of the profession in which you're working, and sort of in a range of industry settings. As I say, there's an insurance issue because you're an unqualified undergraduate that you can't then start providing sports therapy for people, but you can certainly be involved in observations and certain elements of the sports therapy process. More likely you'll end up in strength and conditioning, performance analysis or sports coaching. The main goal is to reflect on your own experiences in industry and demonstrate some sort of reflective cycle and learning from that process. You can go abroad for this placement, but again, we need to agree, as with all placements, the programme team need to agree your placement before you start. We have a range of options in terms of learning styles here. We've got a nice small group for the first year, it's 25, and we're looking for 50 students for each year after that. We do group learning, we do case-based learning, we have lectures where we stand there and deliver information, but there will always be an element of discussion and activity within there too. And the idea is to make it as interactive as possible. We understand that most of our applicants learn by doing, so we would rather spend the time doing stuff and kind of physically working with people rather than just talking to you about how you would work with somebody. In terms of assessment methods, we try and choose the most appropriate method to assess the skills that we need to. There are 392 competencies currently embedded in the programme in order to align with accreditation from the Society of Sports Therapists. So we obviously need to ensure that not only do you have a basic understanding in terms of the knowledge required behind what you're going to be doing, but actually that you can actually safely and effectively work with clients as well. So practical assessments feature heavily, objective structured situational examinations, so OSCEs, feature heavily because it means we can assess your actual work, how you physically work with someone. But obviously you also have poster presentations, group and individual work in terms of essays and case reports and things, and final dissertations. So because you are a professional undergraduate, an early career professional, you have responsibilities not only to the university, the faculty, the department, yourself, the course, so us as your programme team, but also the Society of Sports Therapists. So all I would say is attitude, attendance and application are really important here. You have to have the right professional attitude, otherwise you're going to be behind from the start, really. because we need you out gaining sort of experience, observational experience, and you can't gain that if you don't have the right attitude in order to be placed somewhere. Attendance, we have an 80% attendance policy for this programme because obviously you need to be safe and effective when working with clients, and if you miss too much, then that's not going to be the case. An application, I just think it's attention to detail, it's having a passion for what you're doing and for realising that actually this is a profession and a career that we're training you for, so we need to have that kind of mindset from the start. So you're a university undergraduate and an early career professional. So time management, self-organisation, high standards of communication, professionalism, respect, all that sort of thing, absolutely important. And we have a fitness for practice process that we can take students down if they are not represented at the university appropriately or they're not safe or effective in terms of their care that they're giving clients. To support you at Bournemouth University, we've got a really nice Grow Up BU programme. So this is an approach to developing resilience and independence, helping learners reach their full potential. We have a specific community designed for that, but actually also we have academic support. So you have a year tutor or an academic advisor, additional learning services, skills workshops that you can take part in, because the step up to university is actually quite big, really. Practice, we have practice placement educators and academic tutors involved in placements. And we have peer support, so you have students from level 5, peer mentoring students from level 4, so that's really helpful to see kind of what you're aiming for. And we obviously have the student representative system. There's also a strong pastoral support here and wellbeing centre at Bournemouth, so we've got academic and practice links and then the counselling service, health and wellbeing and chaplaincy and all that sort of stuff. But the main thing, also the main point of the interview I find is for you to decide whether actually we're the right university for you, as well as us decide if we want you to represent the university on our programme. So look at the balance of coursework and exams, what's appropriate for you, how do you learn best, how much assessment is by group work, for example, opportunities for workplace or applied studies, and fieldwork and practical learning. So we've made sure we try and embed as much balance in terms of coursework and exams as possible. And obviously a lot of workplace experience because we know people learn by doing. You also then need to look at will you meet the entry requirements in terms of the required subjects, required minimum grades, and English and Maths GCSE. So university is a unique experience. It's one that people sort of treasure throughout their time, particularly if your degree is setting up for a career. Obviously this is your kind of key training element. So it's a balancing act between social, academic, family, sport, all that sort of thing. We on Sports Therapy really encourage you to join teams, so one of the university teams if possible, just to keep your own fitness up really. We want healthy practitioners out there making positive influences on people's lives. It's a professional degree, so we have high expectations in terms of our sort of academic staff team and the industry professionals that we engage with. You can see more about Bournemouth University if you visit the virtual tour for a 360 view of our facilities, accommodation and study and social spaces if you haven't had an opportunity to come and see us. But please do also send us your questions if you're looking at this with view to potentially coming down or applying or something like that, then just you can always contact us and ask us any particular questions. So thank you for your time. Thank you for listening to us. It was a bit of a whistle-stop tour in terms of our new degree here in terms of sports therapy, but it's an exciting opportunity to be involved in a really innovative programme. So I really hope you apply and that we see a really strong personal statement come through.